Hello, my name is Beatrice Jan and I'm a final year medical student from Swansea University. Can I confirm your name and date of birth, please?
Helen Jones, 25th of November 1988.
And how old does that make you?
28.
And what would you like to be addressed as?
Helen.
Okay. Today I've been asked to perform a cranial nerve examination. This essentially involves a neurological examination of your head and neck. There are many components to this examination, but I will talk you through it. Do I have your consent to continue?
Yes.
And can I offer you a chaperone?
I'm okay, thank you.
Okay. To start off, have you noticed any change in your sense of smell or taste?
None.
No. And are you able to stand at this moment?
Yes.
Okay. I'm now going to test your distance vision. Do you usually wear distance glasses?
No.
So I'm going to ask you to cover one eye and then read from the top down to as low as you can read.
HALTNCOLHAECTNO. HALTNCOLHAECTNO. CLOHNA. AENLOHCT.
Thank you very much. Can you sit back down, please? I'm now going to test your field of vision. I'm going to move my fingers, and I want you to keep your head looking straight at me, point to which fingers are moving. Okay. Thank you very much. I'm now going to move this white-headed pin from the outside of your vision to the center. I'm going to ask you to keep looking at my eyes, but cover one of your eyes. Let me know when you can see this white tip.
Yeah. Yeah.
Keep that eye covered.
Yeah. Yes.
And if we do the other eye.
Yeah. Yes. Yes. Yes.
Thank you very much. I'm just going to assess your blind spot, which is something that everybody has. I'm going to use this red-headed pin and move it in the center of your vision. I want you to let me know when this red tip disappears and when it reappears. For this, if you keep your eyes looking at mine and if you cover one of your eyes again.
Gone. Back. Gone. Back. Gone. Back. Gone. Back. Gone.
And if you just cover the other eye.
Gone. Back. Gone. Back. Gone. Back. Gone. Back. Gone.
Thank you very much. I'm just going to shine a light into your eyes. If you could look at the wall behind me. Thank you very much. I'm just going to hold this pen torch in front of you, and I'm going to ask you to look at the clock behind me, and when I ask, I'm going to ask you to look at the pen. So if you focus on the clock behind me, and now look at the pen. Thank you very much. Now I'm going to test the movements of your eyes. Keeping your head straight, I'd like you to follow the movements of this pen with your eyes. Let me know if you have any pain or double vision. Thank you for that. I'm now going to test the nerves of your face. I'm going to place this on your face and I want you to let me know that you can feel it and it feels the same on both sides. This is what it should feel like.
Yeah. Same. 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 Same.
Thank you. If you could open your mouth for me and don't let me close it. Clench your jaw and relax. Clench your jaw and relax. Thank you. Now I'm going to ask you to pull some funny faces with me. It will help me assess the nerves of your face. So if you raise your eyebrows, that's great, and scrunch up your eyes, don't let me open them. Bare your teeth, puff out your cheeks, hold it there. Pass your lips together and don't let me open them. Thank you. I'm now going to test your hearing and I'll explain more as we go along. I'm now going to whisper 3 numbers and ask you to repeat them back to me. At the same time, I'll be rubbing the other ear to mask the sound. 379.
379.
543.
543.
Thank you. This is a tuning fork and it will make a sound. I'm going to place this behind your ear and then next to your ear. And I'd like you to tell me which sound is loudest, okay?
Okay.
So sound 1. Or 2.
2.
And again. Sound 1. Or 2.
2.
I'm going to place this in the middle of your forehead. I'd like you to tell me if you can hear it louder in one ear or if it sounds about the same.
Okay. Same both sides.
Okay. I'm just going to look inside your mouth now, if that's okay. I'm going to use the tongue depressor to help move your tongue out the way and shine a light inside. If you could just say ah whilst we're doing this.
Okay.
That's great, thank you. Can you take a sip of water for me, please? And now say baby hippopotamus.
Baby hippopotamus.
And if you just turn to the side, can you give me a big strong cough? Thank you. Could you open your mouth for me? I'm just going to have a look at your tongue. Thank you. And if you stick your tongue out and move it from side to side, as fast as you can. That's fine, thank you. And if you push your tongue into your cheek, and don't let me move it. If you push your tongue into the other side of the cheek, don't let me move it. Thank you. We're coming towards the end of the exam now. If you could just shrug your shoulders for me, and don't let me move them. And if you turn to look this way, don't let me move you. Turn to look that way, don't let me move you. Thank you very much. That completes my examination. I will now report my findings to the examiner.
Thank you.
I was asked to perform a cranial nerve examination on Helen Jones, a 28-year-old female. The patient reported no prior problems with her sense of taste or smell, although these weren't formally assessed today. There was no significant abnormality detected in cranial nerves 1 to 12, although the patient had a visual acuity of 6/12 vision in the left eye and 6/6 vision in the right eye. In summary, this was a normal cranial nerve examination. To complete my exam, I would like to test near and colour vision. I would also like to perform fundoscopy, as well as assess for the presence of corneal reflex, jaw jerk reflex, and perform a full neurological examination. Depending on clinical history and findings, I may also decide to send the patient for relevant investigations, which may include radiological imaging, bloods, or further audiology or ophthalmology assessment.